Got it.
Look at me. I am going to read their bios, but they can tell you a lot more about themselves than I will in the next couple of minutes. Stef is a Price, Utah native, ceramic artist, and dog parent. They are the programs manager for Utah Naloxone and received their BS in Health, Society, and Policy from the University of Utah. They have functioned in various roles within medical administration management for over 12 years. As a person in long-term recovery, Stef is passionate about their work in harm reduction and substance use disorder work. Riley, who's right next to Stef, is a crucial member and successful leader in our community's efforts to address substance use disorder, as well as a champion for recovery, harm reduction, and mental health. Riley has years of experience in the realm of substance use disorder support and knows how to effectively assist individuals working toward positive change. Riley has acted as a liaison and bridge builder between communities with common interests and often hard to reach populations. With Riley's experience, he understands the importance of building relationships with community partners and individuals participating in services programs to have the biggest impact on better health outcomes. He works at Utah Naloxone as a senior technical trainer, and feel free to add anything that I might have missed, but welcome to the stage.
Hello, everybody. After lunch, everyone's probably sleepy. I'm sleepy. I'll pretend like I'm not sleepy. So before we jump into this, I just wanted to start and say something that's pretty important to me. So I probably know 9 or 10 people in this room, and all of them are absolutely brilliant in their own way. And between those 9 or 10 people, there's probably, they've helped thousands and thousands and thousands of people. And that's just between the 9 or 10. So I don't know how many people are in here. I'll guesstimate 200 or something. So the reason I'm saying this is connection is key. So all of us are here. We all have one common goal. So definitely talk to people, mingle, go talk to somebody you don't know. That's very, very important. So imagine if I knew everybody in here and everybody helped that many people, then we go into helping hundreds of thousands of people, helping all of Utah, helping all of the West Coast, helping everybody. So talk away, mingle. Sometimes it's a little uncomfortable to just go talk to a random person hey, what's up? But it's always a good thing to do. So I also wanted to ask who here, I'm sure most of the people, but harm reduction. Who knows what harm reduction is here? Just by raising hand. Okay. And I'm sure, I don't know about in this room, but sometimes people are against harm reduction. Maybe they don't have the facts. Maybe they haven't looked into it too much. Is there anybody in here that is I don't agree with harm reduction at all? Raise your hand. It wouldn't be a problem. I would just like to have a conversation with you. And if I can't answer any of those questions for you, I know that out of the 9 or 10 people that are in this room, they absolutely will be able to. And if not, then we can keep going down and down the line until we can explain this the best way possible. So anyways, we're doing the principles of harm reduction and Utah Naloxone's effort. So Riley, I'm a person in long-term recovery. I'm coming up on 8 years. Yeah, it's definitely been a journey. And I've just tried to follow my path after getting into recovery from one place to the next to where I felt like I could actually make a difference with people. So I started out at VOA Detox because I had been to VOA Detox. I never made it through all the way VOA Detox, but that place had a very special place in my heart. I would say it's last stop on the block, basically. So I ended up working there. Then I was lucky enough to go and work with USARA. USARA is amazing. They help lots and lots of people. Peers in anything is very, very important. Peers can be everything. So I've gone and interviewed firefighters, and the thing that helped any firefighter the most is talking to another firefighter about what they've seen and been through. So it's super important. And then from there I came to Utah Naloxone. It's been a long road for me going from the very first treatment center I was in. You have to be sober. You have to be dead sober. You're supposed to go from using for the last 8 years of your life to detox for however many days, and then you're supposed to flip that switch and you're supposed to be sober. No help, just sober. So I'm glad that things have changed a lot over the years since I got into recovery, and it's been amazing to watch the change absolutely everywhere. It's been great. So we work for the University of Utah. We're housed in the Department of Pediatrics. I also wanted to say that I'm really excited for Stef to be doing this here, because she's told me so many stories just about this community. I've only drove through to go to Moab or something, and there's so many different places that she's told me just different stories about when she was in her active addiction, and then just, I mean, look at Stef now, she kills it. So anyways, let's jump into this. I kind of want to do this. There's not 1,000 people in this room, so if there's a question, we're gonna do questions at the end. But if I say something and you're just I want to know, or I don't believe that, or whatever it is, just raise your hand. We can chat it out for sure. So, what is harm reduction? It refers to an approach designed to reduce harmful consequences associated with high-risk activities. This next one is super, super important to me. It really came out when I was doing peer support, but then even more so when I started doing harm reduction. So we do not try and save or rescue anyone. We support them wherever they are without judgment or assumption. So that one, even for me, when I started doing the harm reduction realm, even for me, that was kind of hard to grasp at first, I'm not gonna lie. I'll be very open with how I felt and how I do feel now. So it's really, really easy to judge another person, obviously, it doesn't even matter. But like what the speaker before this said, everybody is somebody's mom, dad, brother, friend, cousin, whatever it is. And everybody is very important to somebody. So I always try and keep that in mind as best I can, for sure. So harm reduction models are evidence-based and are constantly evaluated to show good results and effectiveness. This means that they are an ideal model for anyone who works with individuals who are engaging in behaviors that put them at risk for harm. And so this next part, it says, which some say involves almost everyone on the planet. So to me, it's not some say that. For me, everybody is a risky person in some way or another, whether that be too much sugar, too much nicotine, too much fast food, whatever it is, everybody has something that they can reduce their harm with. So we'll jump into the next one, and then Stef is gonna go over the principles of harm reduction.
You guys are gonna be clapping a lot because we're switching off a lot. But it's okay. That's one of the things that we said when we got here was we love that everybody's clapping for everyone. It makes us feel, thank you. Hi, my name's Stef. I grew up in Price until I was about 18, and then I got as far away from here as I could. That kind of goes hand in hand with small town mentality. I am a person in long-term recovery. I've been recovered for a long time. This month, actually, on the 29th, will be my 20-year sober anniversary. Thank you so much. So it's pretty cool to be back here and have this be full circle, and be able to talk about harm reduction in Price, because when I was in active addiction, when I lived in Price, we definitely did not have the resources and the education and the knowledge that we do now. So I'm just really proud of my community and my hometown for opening up their minds and their hearts and being able to give people a second chance. So we're gonna go over some harm reduction principles. Again, like Riley said, if you guys have questions while we're talking about this stuff, feel free to raise your hand. I know that we just had lunch and we're sleepy. Mercedes, I just saw you yawn, so I can see you. Okay, so one of the first principles is human dignity and human rights. So this is basically, we're recognizing the intrinsic value of dignity of all human rights. We're not judging individuals based on their behaviors. We accept that isolating people in communities based on moral judgments is harmful. It enhances social and health programs, disease prevention, and education by reducing oppression. So having an open mind, being willing to meet people where they are, not judge them for their behavior, but just basically give them the tools and the resources that they need to be well is very effective. Expects accessible, flexible, culturally responsive, and non-judgmental services for all people, and recognizes the rights and abilities of individuals in making their own choices. So it establishes quality of individual and community life and well-being as criteria for successful interventions and policies. Rather than just being totally strictly abstinence, harm reduction provides programs that help people be well where they are. It helps prevent disease, and it helps the wellness of the community as a whole. Values of harm reduction. So we all know that there are people that are risk takers and there are people that are not risk takers, but how would you guys define risk? This is a question that you can answer out loud.
I don't know what it is, but I'm gonna do it.
How would you define risk, Michelle?
People maybe think it's dangerous.
People maybe think it's dangerous, right?
Something that might have life damaging consequences.
Okay,
Yeah, possible harm.
possible harm. So we're identifying risk as possible harm. You?
Something that takes you away or varies you from a desired result.
Yes, I like that. I like all of them. I like all of the answers. They're all true. But risk doesn't necessarily have to be associated with harm, right? Yes?
Anything that goes against the social.
Yeah, that could also be true. If that's the case, then I feel like I am a huge risk, especially in small town Utah. But it's risky for me if I only have $5 in my bank account to go buy something from a gas station that I don't necessarily need, like a candy bar or something, right? Because then I'm risking overdrawing my account. Bottom line, we all take risks. So values of harm reduction, part of that is just accepting that risk taking is normal human behavior. We do it every day. Recognizing that people have more success in changing the behaviors when they make choices that reduce the possibility of harm, rather than eliminating the harm or risk as their first step towards change, is super important. There are many pathways to wellness. Substance use and recovery is only one of them. Substance use recovery, not and recovery. Substance use recovery is only one of them. Abstinence with harm reduction is neither required or discouraged. While abstinent-only approaches to drug use focus on the cessation of all drug use, harm reduction prioritizes the community well-being and quality of life, which is super important. If somebody has an improved quality of life and they're able to feel better than they did without a harm reduction program and increase their wellness, they're more likely to continue to make those positive changes. That might lead to recovery, that might lead to treatment, it might not, but still overall, energetically, the community is more well. It may include abstinence for some people based on what works best for them, but because drug use is also about so much more than substance itself, policies and programs to address drug use also have to be about much more than that. That's where we can get into providing resources for different communities that may not have access to resources very easily. Syringe access is the most effective evidence-based prevention tool for HIV and hepatitis C. A lot of people don't really have a great feeling about syringe exchange, but it prevents diseases. It keeps people from getting more sick. It improves well-being in people, therefore improving well-being in the community. And by making those constant positive changes, more positive changes are guaranteed to come after. So it encourages people to be able to start where they're at. I know when I was in active addiction, I didn't know, but I definitely don't think that we had harm reduction programs that would allow people to start where they were. Part of me getting sober was me getting out of here. It's not because this place fosters drug addiction, but I definitely didn't have a safe space for me to talk about my addiction actively. I thought that going really far away would help me stop using. I was a very functional addict, so I basically used a lot of substances to help me get through high school so that I could leave. Turns out that culture shock is a real thing, and going to the East Coast to a very liberal college probably, in hindsight, wasn't the best idea. I don't regret anything, but I had a lot of freedom to make a lot of dumb choices, and a lot of availability to other things that I probably wouldn't have here. If I would have had those resources early on, and I would have been empowered from a peer support coach or a program to let go of a lot of that internal shame that I carried, I feel like my life would be totally different right now. But I do love my life, so don't think that I don't. So focusing on harms. Decades of research show that harm reduction increases public health and well-being without increasing drug use, violence, or crime. According to the CDC, people with access to harm reduction programs that include syringe exchange programs are 5 times more likely to enter treatment for their drug use than those without access, 3 times more likely to stop drug use that is impeding their quality of life, 50% less likely to contract HIV or hepatitis C, and more likely to survive a drug-related overdose. Let's clap for it. So how we do this in implementing harm reduction programs is oftentimes we have to challenge harmful policies and practices that are resulting from myths within and about communities and about risk-taking behaviors. So earlier on when I asked you guys to assess risk or tell me what you thought risk was, a lot of people said that risk was correlated to harm, which with harm reduction, a lot of times that stigma is carried through. There are a lot of myths about harm reduction that I think our job as harm reductionists is to debunk, and Riley will talk about that in a little bit. But being able to have that conversation and talk to people helps change the mindset of communities to implement harm reduction and improve well-being. Challenges harmful policies and practices that isolate individuals and communities to prevent them from accessing needed services. A lot of the participants that we work with on a weekly basis are unsheltered. They don't have access to transportation. They don't have money to go get treatment. They don't have money to go get medical care. Harm reduction programs can give them those tools and refer them to those resources that help them access those resources, improving the well-being of the entire community. So making available support in other forms to meet clients' wants and needs to help meet them where they are. Providing information to them, both verbal and non-verbal, resources, printed resources, things that you can just hand them if you're walking by or if they come into your clinic and they want more resources on housing or free dental care or something like that, improves the quality of life immensely for each individual. Achieving balance in this demands that individuals and communities affected be directly involved in organizational strategies for harm reduction. So that means community members and also people with lived experience. Also people who use drugs, who are in active addiction and using drugs or substances. Be involved in having conversations and communicating with one another about assessing the needs, figuring out what the community needs, what a population needs, is super important. Recognizing diversity within the community or communities and accepting that there is no one homogenous group. There's no one group that is the same. People who use drugs are still different. People who use drugs are individuals. Each individual is different. Each individual learns differently. Each individual has a different story. Each individual approaches their addiction differently. So being able to meet them where they are as individuals is super important. recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability and capacity for effectively dealing with drug-related harm. So all of those things that I just listed affect each individual. Maybe not all of them for one individual, maybe two for one individual. I know for me, I could pick out 3 of them from that list that affected my life and contributed to my drug use. If I had resources to deal with those things, again, I probably had a way different 20s, way different decade in my 20s. It would have been totally different. That contributes to the safety and well-being of the entire community. Dealing with priority issues recognizes the right for comprehensive, non-judgmental medical and social services and the fulfillment of basic needs of all individuals and communities. So a lot of this goes back to our providers. I know that for us, sometimes people tell us that they don't want to go to the hospital to get treated because of the way that they're treated. So having a harm reduction program that can provide some of these resources like wound care, STI treatment and testing, stuff like that, and creating a safe space with a relationship that you've already built with another person helps people get the care that they need. It supports development and provision of accessible harm reduction tools and information. So those are the principles of harm reduction. Now Riley's going to talk about some myths and facts.
So we got like 10 minutes left for this, so I'm gonna kind of whiz through these. So if there's any of them that you're like, yeah, right, that's not true, just throw up your hand. We'll talk about it real quick, or we can talk about it after this. So myths and facts about harm reduction, there's definitely a lot out there. I would say these are more of the basic ones. So we'll just run through it real quick. So myth, harm reduction programs enable and or promote drug use. I know that there's a lot of people out there that still believe that. And they, they'll never change their minds, and that's okay, because we know what we're doing is absolutely helping people. We see it every single day, and when you see just those little changes in people, it's amazing. It's life-changing for me, for sure. So the fact is, harm reduction enables people to make informed choices and encourages safer substance use should someone decide to use any substance, illegal or legal. And I think there's a lot of people, I would say especially in Utah, that it's like, oh, somebody's using drugs right now. They're using heroin. It's like, no, they probably started with pain pills. That's where I started. I got hurt snowboarding a lot, and it literally started with prescription, got hurt on prescription, and then it just went on from there. So definitely remember that legal, illegal part. So myth, it's legal to give out needles. I say needles, syringes. If I'm talking to somebody at our exchange, I'm probably going to say points. That's what most people would call it. If you've injected, if you're in recovery here, you probably call it a point also. So hopefully that doesn't offend anyone if I say needles or syringes or whatever it is. So distribution of needles, syringes, points, and drug equipment is not a crime. There was a law passed in Utah in 2016. So police and healthcare providers share in the understanding that harm reduction programs use a harm reduction strategy. That kind of twisted my mind the first time I read it. Did everyone get that? Good? Okay. So myth, harm reduction programs mean there will be more needles found in my community. Could that happen? Absolutely. But if they're going to a harm reduction program, they're going to get syringe containers. They're going to get any size they want. Steph's going to go over that even more in a second. But I also have some data that we'll go through right after this. And I mean, it'll blow you out of the water if you were thinking that. Like, we receive way more syringes than we give out, which is sweet. People will come into exchange and they're gonna get, if they're unsheltered, they're gonna get this guy's 10, this guy's 10, this guy's 10, and he's gonna bring all of them so that he can try and get everybody clean syringes. So it's pretty sweet how it goes. So we encourage users to return used syringes to the program for safe disposal. So like what I was saying, we'll give them any kind of container that they want, anywhere from fit packs to like basically a garbage can, like whatever you need, we'll provide it for you if you're gonna use it. So with options available, needles are less likely to be discarded unsafely. So benefits of a harm reduction program, I'm sure a lot of you know these, I'll just run through them really quick though. So reducing harms to those involved and to their families and their friends and society. So being on one side of all of this for years and years and years when I was in my active addiction, as soon as you go to the other side and you're the family member, it is so much harder. So much harder. So now it's so wonderful because I know about craft and I refer so many people that I know to craft now because they are family members and they are struggling. But if we're reducing harm for their loved one, that is going to help them. Harm reduction would be going to a craft group and learning how to help yourself become better for yourself and the person that you're caring about. So let's keep going. So thank you. I like the clapping. It's nice. So reducing the spread of Hep C, HIV. Steph said that earlier. One of the most important ones for sure to me is empowers people to choose what is best for them and when they're ready to take the next step. I wanted to say something earlier about when we were talking about like incarceration and release. And it's like, to me, in my mind, a lot of that stuff happens and there's so many things that they're doing now to help people after incarceration right when they're getting released, that second or right before. But in my mind, when I think about that, if you get incarcerated and you can't use your substance, they're forcing you to stop that. Does that mean like all of a sudden that person's like, oh yeah, I was in jail, I don't want to use drugs anymore? It's like, no, you want to let that person make that choice for themselves. Me personally, as soon as somebody told me like, you're going to do this, you're going to treatment and you're going to get sober, even in my head, I knew that's what I needed and that would be a great outcome for my life because somebody was telling me you have to go do this. It was an absolute no. Like, I am not doing that. But as soon as people gave me an option and kind of planted those seeds for me, that's when it stuck. Because in my mind, they knew what they were doing. But in my mind, I was like, oh yeah, I'm making this decision on my own. I want to do this. So that one's super, super important. Offers opportunity to stabilize their lives, obviously, decreases crime, increases access to care and services. That one is key. Steph's gonna go over a bunch of slides. We have so much information in our clinic. I mean, people could literally leave with a backpack full of handouts. And if they have questions, sweet, I'll go over whatever you want. If I don't know the answer, we're gonna find the answer for you. If you need help with something that I don't know, I definitely know somebody that has those answers. And then increases support system. That's the most important thing ever. If you have a strong support system, if you have that person that you can go and talk to, it doesn't even matter if it's about addiction, about just being a human. If you have that one person that you can be open with and ask for help, it's wonderful. If you don't have that and you've been in that dark spot where you bundle it all up, it is an absolute nightmare. It literally is the worst thing ever. And then even more important, I just keep saying, oh, it's so important. I'm just going to keep saying that as we go on. So, what's that?
We have until 2, just so.
Oh, yeah?
Yeah.
Oh, sweet. Oh, we have to 45.
No.
2 o'clock. I guess we have time. Any questions?
Slow down, take a breath.
Just kidding. Okay, so this one, when I started working at Utah Naloxone, blew me away. It absolutely blew my mind when Dr. Plum was telling me this. And then working there for a while, it is absolutely true. So let's not forget about preventing overdose deaths. So 90% of naloxone reversals come from community members who use drugs or they're around people that use drugs. People who use drugs are the lifesavers. They save so many lives. It's absolutely insane. The reversal numbers that we get, we'll go over some of those in a minute too. But it's literally every single day we have clinic, there's reversals reported. Yeah.
I'm an EMT, and when we go on an overdose, every single time we've gone on an overdose, the people that are with them have already given them contracts.
That is so amazing. That's so great. That's the dream right there. the first responder is usually not the first person there. Hopefully there's another person, just a random community member, just an individual. That's who's gonna save the life. Absolutely, EMS for sure, they definitely save lives also. But if there's somebody there in that moment, they have a much greater chance of surviving. So there's by far way more reversals reported to us from syringe exchange partnerships, by far for sure. So that's also another wonderful thing. And then Steph is gonna go over this one.
Thanks. Sorry to hurry, man.
I know. I thought we were out of time. I was like, oh, go.
You did great. But that means that we'll leave you guys time for questions if you have any. So Utah Naloxone also participates in harm reduction because naloxone is harm reduction. Saved my life a couple of times, which I'm very grateful for. And having naloxone overdose prevention education is our main mission, and getting naloxone out to community members in order to save a life is what we focus on. But we also have syringe exchange and syringe services a couple of days a week in our clinic, and we partner with other syringe exchange service providers in Salt Lake City and all throughout the state. So people will come in for services and we'll make sure that they have clean syringes. We give them sharps containers large enough to match the number of syringes given out, as well as personal preference. So sometimes people will come in and want a small container for themselves, but they also get a bigger container because, like Riley said, they go around to different encampments and gather the syringes there. So we have all different sizes that we'll give out. Fentanyl testing strips, education and instructional handouts, which thankfully this year our founder and medical director was able to get fentanyl test strips off of the paraphernalia list. So now you won't get arrested if you have fentanyl test strips, which is great. It's saving a lot of people's lives, especially in this past year or so. I mean, fentanyl's been here for a really long time, but in the past year or so, I'm sure you guys have heard a lot more about it. Increasing overdose deaths from that specifically. We give out harm reduction kits that include safe injection kits. So supplies like alcohol swabs, sterile water, Band-Aids, bandages, tourniquets, cookers. Again, these harm reduction efforts help improve the wellness of people in meeting them where they are, making sure that they have clean needles, sterile water, they're not needing to share any of those things prevents diseases. Access to wound care and STI testing and services. We're able to give them referrals, or, if our medical director is there, can assess a wound and give them what they need. Referrals to detox, bridge programs, Super Rad program, and access to peer support is also super important. We have a lot of those things in our clinic. So I'll just show you a couple of photos of our clinic. So this is the lobby when people walk in for their syringe exchange services, or if you just come and hang out with us, which is encouraged. We're pretty fun. So people will come in, we have a lot of art on the wall. We don't want it to look like a doctor's office. We want people to feel comfortable. Building those relationships again with your participants is so important to helping them get well. We have our clinic room. We have a hand washing station, so people will come in, drop their dirty syringes in our sharps containers, which we then dispose of at the health department. We have them wash their hands and then assess their needs and what they need in terms of syringe exchange. So this is our resource table and our syringe room. So they'll come in this room with us. We'll ask them if they need naloxone. We'll ask them if they've used naloxone on anybody, get information from that for our reversal reporting data, give them syringes, safe injection kits, fentanyl test strips, sharps containers, anything extra that they might need. We then have a hygiene closet that we take them to where we can get them hand warmers. Around the cold weather time, we'll give them gloves, hand sanitizer, body wipes, crackers, whatever they need. We try to supply them with so that they can leave feeling good. We have our sharps containers. We have information about testing your drugs for fentanyl, whether it's meth, whether it's an opioid, different things about STIs. And so we like to make sure that the harm reduction efforts on top of naloxone that we're providing to our community is helping them continue to stay well.
Okay, so if anybody, I know we just ate lunch, these photos are pretty graphic of wounds, so if you don't like graphic wound photos, I would not.
Practice the breathing.
Yeah, I would definitely not look right now. So there's just two of them, and there's a reason why we put them up here. It's not like, oh, look at the gore and look what happened after. There's a specific reason why we're showing this. So there's going to be two of them. So this first one, this person was someone who came into our clinic when we were doing a PNP project, and obviously on the left, he would not stop injecting into those spots. And I mean, I've seen like wounds, like little infections, but we're putting these up here because this is literally what's happening. I would say, especially with xylazine right now, like the wounds are very, very intense for sure. So this is up here because from the left to the right, this is from coming into the clinic, or this guy actually wouldn't come into the clinic, so we were meeting him outside of the clinic to help with these. Yeah.
Very often, I have trouble getting IVs on people because there are so many abscesses and you can't do an IV above or below an abscess. And the abscesses are because of the needle of them injecting themselves and it's gotten infected. There's no spot.
Yeah.
An IO is where we have to drill into the bone to get an IV. I've actually had to do that because there was no thing to do with IV.
Yeah, absolutely. Yeah. I'm sure you see all sorts of fun things like this for sure. Yeah, it is. It's pretty intense. When they were coming in with wounds for wound care, there were a couple of them when I was first there. I was just like, can't be in this room right now. Like I can't even look at it. It's so bad. After you see like 50 of them and you realize that these people are in this much pain and they are not going to a hospital, it doesn't matter if they're going to die the next day, they are not going there. So that's kind of what we'll get into with the other things too right now. But so really thinking about harm reduction in your spaces is actually thinking about how we can help people in ways that we haven't thought about. So with these, it's like, in clinical spaces, I feel like we get stuck in a certain mindset, and it's like, okay, so they can come into our clinic, this is what we do, this is what clinical people do, this is how we handle this, and it's like, if you want to work and do amazing things in harm reduction, which we have a really, really good team at Utah Naloxone, and Dr. Plum is very, very good at this, think outside the box, have like think groups, talk about different things. So for the first slide, that guy wouldn't even come into our clinic. So literally with outreach, they would go and find him or try and set up a time. And that was all that his whole arm was fixed outside of the clinic. Most people would be like, oh, we can't touch that. You know, there's no way we can even help this person. He needs to go to an emergency department. He has to be in a hospital for us to be able to help him and fix this problem. It's like, well, we figured it out and Dr. Plum did it great and that guy has his arm now and he was not going to a hospital. If that wasn't the case, I would say most likely he would not have his arm for sure. And there's been numerous times in the clinic where people didn't even want to come into our clinic. There was a specific time where a buddy pushed his other buddy in a stolen shopping cart because he couldn't walk because his leg was so infected. And so he got to our clinic and that was literally like, Jen went through all the process, did his vitals, did everything. And it was literally like, you have to go to a hospital now because if you don't, you're gonna die here in the clinic. So that's another thing with talking to people, engaging with people, find champions that can help you with all sorts of things. Jen is a champion, absolutely, at so many things. There's people that I would not be able to work with very well. Yeah, please clap that in, actually. Yeah. Like, she is amazing, like amazing at working with some people that I wouldn't be very good at working with. She's amazing at it. So all in all, think outside the box, talk with people, learn, find those champions, and you can do whatever you want to do if you get the right people at the table. So we're gonna go over, I'll go through like half of these. I'll go through half of these. Okay. So this is a patient navigation project that we did back in 2020, and this is the data that we sent to the CDC. So Andy's Place is what our clinic is called, and that is from Dr. Plum's brother overdosed and died. So she named the clinic after him. So it's Andy's Place. So during that PNP project, 5 minutes. Thank you, by the way, because I thought we were almost over a while ago. So we'll cruise through these real quick. So 23,426 naloxone kits were given out in 2020, so over 46,000 doses. We definitely, I think Dr. Plum had the right idea. Flood the state with naloxone. Try and get naloxone into as many hands as possible, because a lot of those are going to save a life. Anybody can save a life. You don't have to be a medical person. You don't have to be EMS. You can be the random guy like me and you can save a life. So there were 1,326 reversals reported in 2020 for that project. And that was just in the clinic. That was people coming in for exchange or wound care or whatever it was. That wasn't even including the outreach aspect, which always has lots and lots and lots of reversals. So during that time, there were 4,467 participant encounters, which is wonderful. And then this is where I was getting to it with the myths and facts about the syringes and them going everywhere. So during that year, there was 306,000 syringes given out, and we received over 330,000. So that we received more than 30,000 syringes than we gave out. So that's pretty amazing to me. And then as far as fentanyl test strips that year, we gave out 7,800. Wound care, that was really, really, really cool. There were 71 visits. And then Steph will go through some of these other ones.
So remember in one of the beginning slides when Riley told you guys that harm reduction is evidence-based? Here's the evidence. It works. It's evidence-based. It helps communities become well. Where did you stop?
So it was the STI test.
So we were able to, with this patient navigation project, we were able to test 76 individuals for STIs. We were able to test and treat 50 people for Hep C and HIV. We established a direct outreach team, and we accessed about 120 individuals per week. Community service option for members. We do community kit building. We did 13 HCV reversals with intensive case management. We referred 2 people to OBGYN through the Super Rad program, and we linked up 15 people for medication-assisted treatment. So harm reduction definitely helped out a lot of people, saved a lot of lives, and that's why it needs to be implemented and why it's important. So for Utah Naloxone, as of the 30th of September, we've distributed 185,000 free Naloxone rescue kits. We've saved 9,918 lives via overdose reversal with these kits. So that means that 9,918 people got a second chance. And you can't get better if you're dead. The reversals were reported by parents, spouses, friends, people who use drugs, law enforcement, and even strangers.
So we'll go through the law enforcement one. So right now there are 76 law enforcement agencies statewide trained and equipped with naloxone. Lives saved within 24 hours of 5 of the agencies doing it. So Out of all those, there's 5 agencies that started. Within 24 hours of them having Narcan or naloxone, they saved a life, which is absolutely amazing to me. And then there's 726 law enforcement saves, reversals in the first 7 years. So with that, also with EMS agencies, we do a leave on scene program. I'm not sure if there is one down here, but it's for EMS, fire, police, whatever it is. If they go and respond to an overdose and that person denies care, they are not going to a hospital, they can educate them and give them an naloxone kit in case it happens again. Hopefully there's somebody there with them that they can go through it. Obviously you can't save yourself, but that has been absolutely amazing. There are a lot of officers that are so on board with that. It's insane. So that's been really exciting for me personally. And then the program launched with 15 EMS agencies and leave on scene kit. And then also, I guess thinking outside of the box for sure, this was a very good place to do this. We were thinking, where can people in the community go and get naloxone kits where they're not going to be scared? We're thinking police, and it's like, some people are definitely not going to the police department saying, hey, I need naloxone because I'm using, or whatever it is. So librarians, everybody trusts a librarian, right? There's no way you can't like a librarian. So started training librarians. There's lots and lots and lots of libraries in this state that have naloxone. You can go in, ask for a kit. They'll give you some information, tell you how to use it, and on your way you go. You don't have to sign anything. They're not taking your name. Here's a kit. If you need it, I hope you have it and you can save that life. So right now there's 38 total libraries in Utah that have those.
Okay, well, I think Ashley's drawing us a sign that says we don't have any time left. Oh, 1 minute. We have 1 minute for questions, so talk really fast.
Okay, so you talked about it being evidence-based. Are there any other like research like that have been done, or other like places where we could go to see more about like harm reduction?
Yeah, so if you Google SAMHSA harm reduction framework, they have a lot of linked studies and actual like journal articles that have been published that can give you information about how harm reduction has improved communities and people who use drugs in active addiction, or help them like move closer towards recovery.
Yeah.
Outstanding the work that's being done. And I see this being extremely resource intensive. Do you work off grants, or is there any line items in the state budget for this work?
I mean, that's a really great question. For Utah Naloxone specifically, we're fully funded by grants.
Okay, it's a tough way to run.
Yeah, figured it out though. But we do get help from the state, and we definitely partner with a lot of other organizations that all have the same common goal, which is so great to be surrounded by that many organizations so that we can support each other.
Thank you.
Yeah.
Just like it. You're done.
Thanks so much, everybody. If you have questions or want to talk about harm reduction further, just find us. We're pretty approachable.